Hello and welcome to the Global Psychohealthology Summit, Autoimmunity, the Mind Factor. And in this session, my guest is Dr. Craig Winner. Dr. Craig has been in the healthcare field for 30 years, and he has been an educator and lecturer all on complementary approaches to health and working at hospitals, medical schools, universities all across the United States. And Dr. Craig began his exploration of emotional freedom techniques, which is going to be the subject for this interview, in 2007. And he is now an accredited master trainer for the Association for the Advancement of Meridian Energy Techniques, and a trainer of evidence-based EFT for clinicians, and is one of only 4 certified matrix reimprinting trainers in North America. And we will obviously talk about matrix reimprinting EFT also in this session. Along with his wife and partner, Alina Frank, they continue to train and mentor EFT practitioners in North America, Europe, and Australia. And together they have created and directed a wide variety of continuing education programs, including projects such as the soon-to-be-released film, The Science of Tapping, exciting, and the online training, Tapping Out of Trauma. They're also creators of the Matrix Reimprinting EFT World Summit. And Dr. Craig is a neuroscience aficionado and is a contributing author and blogger for the Huffington Post, Energy Psychology Press, and loads of other publications. So this is very exciting. A very warm welcome to you, Dr. Craig. Hello.
Oh, well, it's actually my pleasure and honor to be here with you, Dr. Eva. Thank you so much for the invitation.
So you've been in this healthcare business for 30 years. That is quite a long time, and a lot has been changing over those last 3 decades. So I'm sort of curious as to your observations and how your thinking has developed over this time, particularly in relation to chronic illness and autoimmunity, of course.
Well, thank you. And yes, it's hard for me to even say that it's been 30 years, but it has. It's been most of my life, obviously. So it's very exciting. And I actually think it's very hopeful, and I'm very optimistic about the changes that I've seen. I began, in college as pre-med. I ended up moving into alternative health, massage therapy, chiropractic. I've been a chiropractor for 26 years. But I've always been interested in the psyche, soma, the mind-body interactions, and watching the development of changes that I've seen in research, in paradigms, and acceptance to a much more holistic mind-body approach has been for me, very inspiring. And as I became involved with EFT more specifically, and the different varieties of energy psychology, some of which you've mentioned, that to me, to see the shift, and we'll talk more about it as far as the relationship between what we've experienced, what we think, what we believe, what we feel, and how our body results as a manifestation of, or at least influenced by, those things, and the acceptance and the body of research that continues to grow in that direction. We are seeing innumerable studies that are making this connection, from the ACE, Adverse Childhood Experience studies that I'll mention further, to mindfulness and meditation studies, to even prayer studies. We're starting to see that what I think and believe and feel, the decisions I make, the experiences that I've lived through, how that affects how I see the world, and how that has a direct result of bearing in bodies and illness and chronic illness, and specifically autoimmune disease, that acknowledgement and that acceptance that's continuing to grow, I think is only moving in the right direction, and personally inspires me greatly.
I have to say I completely agree. For me, it's been 20 years, so not quite 3 decades, but it is changing. It's changing, as you said, in a very exciting way, and there is clearly we're gaining momentum, I feel, And this will only get bigger and bigger and bigger, and particularly in energy psychology, it's amazing that people can get wider access to it, and more people are starting to use some of those tools and techniques on a daily basis and to help themselves, and I think that's incredible. Tell us a bit more how you integrate the whole mind-body approach in your practice, because you do work a lot with chronic illness. So just tell us a bit more about how you do that.
I have several hats that I'll integrate. So I still maintain a part-time chiropractic practice. I have a worldwide practice with regard to energy psychology methods like EFT and matrix reimprinting. And so I guess a good example would be yesterday. So I'll just use an example of how this happened. So I've been working with a woman who was in a car accident, and she was having neck pain and hip pain, etc. And so as a chiropractor, I think most people have some sense of what a chiropractor does as far as manual hands-on techniques and therapies. And while they vary between practitioner, etc., I think most people have a picture of that as opposed to EFT, which most listeners probably don't. But what I would say is the person, this woman was doing much better. A big part of as I mix energy psychology and EFT techniques means I'm also much more cognizant of a person's psychological and emotional state. I'm much more aware of providing a sense of safety. I'm much more aware and bring in a sense of the mind body into a session to the degree they may not be so aware of, but I am. So I'll just say that this person has been improving and improving. Not quite resolved yet, but doing very well, feeling very safe, had avoided going to doctors for a time, felt very comfortable and safe. And at one point in one of the sessions, had really started to feel a lot of emotion coming in. And we did some EFT with that. It just opened the door to be able to integrate for her that the pain that she was feeling was both influenced by the car accident as well as emotional states and thoughts about it that were going on for her. She'd been improving, and at the last session a week ago, I basically asked her to look at what, if any, reason does she think that this accident might be either have happened for, might in any way serve her on a bigger picture. So there was just some evocative questions that I proposed to her to just consider. And she, of course, was already open to this, and that's why I proposed it. And she came actually in yesterday, and she said, I really was thinking about that question. And I was thinking, what purpose could this have served? And she proceeded to then share how, because of, we'll just say some very negative and traumatic things earlier in life, she had shut down. She had shut down being touched. She had shut down going for things like massage or chiropractic or yoga or anything that was really very body oriented because it felt unsafe. And so what she then realized, what for her the purpose of the accident was to be able to have to come in, to have to see a chiropractor, to work with me, to start to realize that it was time for her to start to be able to make this connection, to feel safer, to work with her body, through her body, to be able to work with the traumas that weren't completely resolved from earlier in life, and was now feeling safe enough to do that. So for her and for me, it just contextualizes on one hand something very simple, but it gave her a safe place to be able to make the connections between the pain she was feeling, the injury she had, a bigger purpose for things, an opening to be able to work with the earlier traumas in her life that weren't quite resolved. And that's just a small example, just because it's fresh in my mind because it was yesterday. But what I would say is, as a chiropractor, I am often bringing in that sense of safety, bringing in those connections, allowing them to make the connections between the pain that they're feeling, things that have happened in their life, the physical condition they have, the stress-related components. And as a chiropractor, I will often start to move from chiropractic into mixing EFT and broader perspectives. And as an EFT practitioner, what I do is I don't do chiropractic, but we'll talk more about EFT to help people to resolve unresolved events, feelings, beliefs, emotions, thoughts, etc., so that their body is relieved of much of the stress that's happening, so their body can heal, especially so their immune system can function on a greater level. And I know we could go into much further depth, but that's at least the start.
That's right. In this case, this was an accident, but this is the same really story that we see time and time again in clients with chronic illness. There is always an emotional element, and very often it is some level, there is some level of trauma there that needs to be healed. And still surprisingly, even though this is improving, there are still many people who do not make that connection. So of course, through doing what we're doing in this event, we're hoping to raise more awareness of that. So let's, if you don't mind, let's dive a little deeper in terms of what emotional freedom techniques are, and how is this different from other therapies, and why is it so great and effective for people, and in terms of helping them heal.
Sure. I'll start off saying that when I first was introduced to EFT, which is one of many types of energy psychology methodologies, it's probably the most well-known, it's certainly the most well-researched. I would say it's been used by millions of people around the world, so I'll use EFT as a predominant theme because it's my predominant technique, as well as matrix reimprinting EFT, but there are others as well. What I need to say is that when I first heard about it, I guess back in the, over 10 years ago, I was incredibly skeptical. I was very skeptical that somehow that putting pressure and tapping on your face, it looks ridiculous, it sounds silly, that somehow it could result in changes in health and well-being and affect multiple diseases and it can help people with relationship issues and health issues and chronic disease. And I really just put it aside and put it on the shelf and figured it was ridiculous, and it was somebody trying to do some snake oil sales, and I read about it through Dr. Joe Mercola back then. So I just want to let people know that as a scientist, a physician, a chiropractor, that with that kind of background, it didn't make any sense to me. And so it's fine to be skeptical about it. And that's fine with me. I actually think that's healthy. But where I really came to understand better was when I really started to understand the biochemistry of the stress response. And I started to look through the eyes of what do all these problems have in common, or what is at least one thing that can affect all of these different conditions. And it's certainly how we deal with stress. When we look at the role of inflammation, when we look at the role of cortisol and stress hormones and how our biochemistry functions with its response to stress, especially with how our neurochemistry and our wiring and our endocrine system, especially how when we're young and our developing how our body deals with stressful situations, that if that isn't created in a very functional and efficient way, then those mechanisms are dysfunctional throughout a lifetime. And if that mechanism is dysfunctional throughout a lifetime, then any disease or condition that's involved with stress response, stress hormones, etc., can be affected, improved, or decreased based on if we can alter that. So when I started to look through that set of glasses, that starts saying, so if we start to reduce the cortisol, the stress hormones, the inflammatory markers, all of those things, then it can result in affecting many conditions. And we look at autoimmune disease, and whether it's MS, RA, psoriasis, irritable bowel, we start to diabetes, we look at all of those things that are influenced by stress. So when we look to the studies and the research as far as what EFT is and what EFT does, we can look at it on many different levels. On one hand, for those that are more prone to or interested in kind of the subtle energy ways of working with the body, EFT is based on tapping on different well-documented meridian acupoints. So the points aren't random points that we're tapping, they're very specific acupoints, or meridian ends that are superficial, that are close to the surface of the skin. So when we're stimulating those not with needles, but with percussion. Many people will be familiar with acupressure, which is the application of pressure on a meridian endpoint. So that's one piece. What we also know from a psychological history is that as we start to look at the way that EFT works, we're combining elements of what we call exposure. In other words, thinking about something that's distressing, something that we're feeling that's upsetting, something that happened that's still distressing to us. Okay, so we're exposing our mind, our frontal cortex, to that upsetting thing, issue, event. And at the same time, we're counter-conditioning that negative physiological response with a soothing response. So what we find is studies show that just less than an hour of tapping can reduce cortisol levels by about 28%. So when we start to look at that counter-conditioning of thinking of something that's upsetting, something about our disease, something we can't do, something that we're feeling helpless about, and we think of that, and then we're doing the tapping at the same time, we start to create this mismatch that alters the wiring that then allows us to think about and feel and remember something without it upsetting our biochemistry. So he has been doing over the last 25 years or so, and gaining research, and right now there's energy psychology, and primarily EFT has over 4 meta-analyses, 5 systematic reviews, 45 randomized controlled trials, over 39 outcome studies. So we just keep looking at a growing body of research for how this has been effective for everything from fibromyalgia, anxiety, depression, chronic pain, et cetera, et cetera. So to get back to your question, what EFT allows somebody to do on their own or with a practitioner is to be able to reduce the emotional intensity related to the situation or subject. So let's just make it more applicable. So let's just say that somebody has rheumatoid arthritis, okay? And it has all of the effects of that. And it has the fingers that are changed, the joints that are affected, pain, the inflammatory cycles, all of that. People might say, but that's a very physical condition. I can see it. I have biomarkers. I have lab tests that show it's there. How can me tapping on my face, changing what I'm thinking, changing how I'm feeling, affect the real tissues? And here's mostly what I would tell that patient or person I'm speaking to is, yes, but I also know that there are times that you have RA and you are in a tremendous amount of pain and distress. And I know there are other times that you have RA and you're not. So that is very common, that there are variations in our felt and perceived sense of that condition. Well, pain actually is perceived and graded in the brain, not in the tissues. So if somehow we can affect the perception of what's happening in the body, we can alter the perception, we can alter the pain response, we can alter how we feel about what we have, which often has feelings of not feeling safe, of not feeling highly emotional, of feeling helpless, of feeling like the victim of. And all of those things affect our brain's chemistry, which then affects how intense pain can be. So when we work with EFT, we're reducing emotional intensity, we're reducing stress and psychological stress as well. And when we do that, then the body has a response of starting to feel better, feel less pain, feel more in control. And that's really empowering. And that sense of control over one's condition has really limitless effects and sequelae. So that gives you a little bit of a taste, and I know we'll go further.
I'm really glad that you mentioned chronic pain, and yeah, that it is created in our brain, not in the tissues. Obviously, a lot of people with autoimmunity do experience that. They do experience chronic pain, and it's a very, very real thing for them. And I'm hoping that people will be more open-minded to trying the different approaches that we're trying to expose them to through the summit and offering, because clearly constant topping of painkillers is going to really wreck the body further. It's really so amazing to have alternatives to pain medications, and obviously this is one of them, so thank you for mentioning that. The one that I think people will not be very familiar with is matrix reimprinting. So perhaps we can learn more about what it is and what it can do.
Sure. Well, what I'd like to do is say a few things, and I'd like to bring in something regarding what's called the ACE study, because I think this is critical that people understand. So very briefly, the ACE, or the Adverse Childhood Experiences Study, as originally done by Doctors Felitti and Anda, showed a very direct relationship with early childhood trauma and a variety of adult conditions, including chronic disease, heart disease, liver disease, etc. And then what they did in 2009, so incredibly, this is 8 years ago, is they then measured people that had had in the first decade of their life these traumatic experiences. And it might have been physical, emotional, and sexual abuse. It might have been loss of a home and parental structure. It might have been somebody in the home with drug or alcohol abuse, somebody in the home that's incarcerated, somebody in their home early childhood that had mental illness. And so they measured these responses of people that had these when they were young and what that relationship that then had with specifically autoimmune disease. So in this one study, they actually measured 21 different types of autoimmune disease and the relationship. And they found that with people that had either 2 or more of these ACEs, there was a 70 to 100% increased risk of a first hospitalization for one of those autoimmune disease, which is huge. And for every increase in one single one of those ACE events, that the hospitalization rate increased by another 20%. And they studied everything from Graves and Hashimoto's and scleroderma and Addison's and psoriasis and a whole host of autoimmune diseases. So what they looked at and hypothesized was that this early childhood trauma affected their, what we call the HPA, stress response axis, which then affected how their body dealt with stress, how that affected the immune response, and found a tremendous relationship between those early traumas and later adult diagnosed onset autoimmune diseases. There's been plenty of other studies that showed when they've measured veterans, for example, with PTSD and have undergone trauma, significant increased risk for both men and women in autoimmune disease diagnoses. So I think the thing that really needs to be spoken here is the well-documented connection between early trauma in one's life and autoimmune diseases diagnosed later in one's life. Very important to realize, because what we're dealing with commonly with EFT and with matrix reimprinting is being able to effectively work what we call through the body, through not just talking about things, but working with an energetic, body-oriented type of therapy technique that works with that to be able to help to resolve earlier traumas that results in people feeling, for example, we notice a high correlation between early trauma and people that are what we call highly sensitive persons that then have a very high correlation with autoimmune disease. And we see themes. We see themes of not feeling safe. We see themes of feeling like the world is a dangerous place. And I think it's really important that we have heard over and over for autoimmune disease that it's the body attacking itself. There's this idea that somehow our body attacks itself, and that's what autoimmune disease is. And I think that's really a harmful perspective. The body is designed to survive above all else. Biologically, it will do anything and everything biochemically to survive. So the idea that the body is literally going contradictory to that and it's attacking itself doesn't make sense. I think that from a meta perspective and something that I call meta health, we look at there's always a reason for the body doing what it's doing. We may not understand why. We may not understand why this is happening now and why I'm in pain, and pain we always feel like is a bad thing, as opposed to understanding that there might be healing happening, that might be part of a healing process for pain. And because we don't often have a paradigm or a way of thinking of it, we often then, or people with with autoimmune diseases, often feel like their body is betraying them. Their body is the enemy. And so an adversarial relationship gets created between one's mind perspective and one's body, which only accelerates the stress, which only increases destruction of cells, etc. And so when we look at that, we have to have a real paradigm shift here. And what I find every time that I'm working patients with ankylosing spondylitis and patients with diabetes, that when those that heal have somehow been able to find some methodology for starting to understand that and starting to have an appreciation and starting to cultivate. I know this sounds, I don't know how it might sound, but that sense of loving kindness, appreciation, self-compassion, understanding, that is almost always a part of the healing process that results in physical changes in the way that a patient feels. So when we use EFT and matrix reimprinting, it helps us to gain that perception of understanding for our body. It helps us also to work with those underlying traumas that are not resolved from our past, that are perpetuating the beliefs and the feelings that we have about ourselves, that are how we are wired, that just feels like that's who we are. And when we're able to use tapping to be able to shift that perspective, miraculous things happen. I'm not saying every time and all the time, but the body of research that we're seeing is really amazing and outstanding. So to get back to your direct question, because you asked for a distinction between EFT and matrix, both of them often are working with those underlying traumas. But what I will say is that with EFT, I'll put it this way, that in EFT, we're either working with how we're feeling now. So for example, somebody could say, I have pain, but it's not emotional. And I would contradict that, or I would at least offer, I don't know anybody with chronic pain that doesn't have emotions about it. Whether they feel angry, whether they feel helpless about it, whether they feel like a victim to it, whether they feel disappointed that they can't do things with their children, whether they feel scared of doing different activities because it might aggravate, whether all of those things, there are emotions involved. And that's the part we work with EFT. Matrix reimprinting, we take to another level. Matrix reimprinting, what that is really working with the concept of what we call memory reconsolidation, which we're working with our past selves. We're working with younger parts of ourselves. Parts work is another way that some people describe a piece of matrix reimprinting. And what that is saying, let's just say that something happened to me when I was young that was quite negative, and it could have been witnessing violence. It could have been a car accident. It could have been a natural disaster or a fire. It could have been the loss of a loved one suddenly. All of these things are traumatic events. And when we use matrix reimprinting, we in a sense go into a type of light trance state. And when we're doing that, we go and we connect with that younger self that was experiencing that traumatic event. And when we do that, this is one of the ways we do matrix reimprinting, when we do that, we are able to then be there for our younger self, to support and assist them, to find out what they needed and didn't get at that time. And when we do that, we also find out the decisions that were made, the attitudes that they adopted because of that event, and we can work with them from our current self to be able to assist them, support them, be there for them, and be able to then work with altering and changing the decisions and beliefs that were made back then so that they affect our current life and how we are moving forward. Because the greatest predictor of our future is always our past, right? It gets embedded and wired into us. So when we're doing matrix reimprinting and we're tapping on different points and we're imagining working with this younger self, it is amazing and profound the information that we get from that younger self, resolution that can be achieved. It literally changes people's lives, and I've seen it over and over affect their health in ways that they never expected could have happened. So on one hand, there's a sense of kind of this magicalness, and I get that. But until you experience that and until you watch it happen over and over, it's kind of hard to believe sometimes, but it really is amazing.
Absolutely, a very, very powerful way of working. And what you also mentioned was meta health. And just in case people are not quite sure what that's to do with, could you elaborate a little bit on that?
Meta health has its foundation and really work based on what's called German New Medicine. And really what meta health is a perspective of the way that the body works and a way of inquiry to working with health, physical, mental health conditions, etc. And what it really pays tribute to is the understanding that the body is always doing its very best. The body is always working in such a way that we may not understand, that is always working for our survival. So the way that I would address that here is there are, for example, different phases. Every tissue and every condition that's related to a tissue goes through different phases. It goes through what we call a stress phase and a regeneration phase. The problem is for people is that most people think of pain as bad. Most people think of pain, swelling, inflammation as something they don't like, when for especially our musculoskeletal tissues, our joints, that it's actually part of the healing phase. And what this model starts to look at is what is often unknown by most people, is that what we call, they're either original traumatic events, or there are things in our life that remind us of, or similar to, or we have a conditioned way of responding to similar events that feel like those original traumatic events. And what those do is they send our body into a stress phase. Now, just because it's not symptomatic doesn't mean it isn't going through the stress phase. And as we start to move toward healing, and as things happen that we take actions of self-care and positive things happen that then move us in to the regeneration phase, that it's then that often the symptoms start to be felt. Well, when symptoms start to be felt, we then tend to be more anxious, more stressed, more angry, more emotions come up, and we're less apt to do the self-care to facilitate that moving through the regeneration phase. So what happens is our biology is always shifting its attention to different tissues. If some are doing more and proliferating, other tissues are doing less. But because we don't often have a way of understanding that model, it doesn't support us in being able, well, when we do have that perspective, it supports us in understanding when we need to do more self-care, when we need to do more rest, when we need to do those things as it's going through different phases. So the meta-health perspective also helps us to pinpoint what tissues are affected and what types of issues and or traumas are at the root cause of those kinds of conditions, or at least significantly involved. So for example, when we start to look at conditions that affect our musculoskeletal system, they very often have themes and roots in decisions and experiences that had us feel insufficient, that had us feel less than, that had us feel like I'm not up to this task. And so we have this integrated winding of these themes in our life, these beliefs that get created that are involved with the conditions. The conditions then reinforce the beliefs, the negative emotions that are thematically tuned into that, the circumstances in our life that then justify and back those up. And so we start to see this incredible weaving of physical conditions, physical symptoms, emotions resulted, beliefs and decisions that are created around that, that we need to be able to pry apart so that healing can happen and bring understanding and light too. So that goes into just a little bit of depth of the meta, but it's much more, but that's a start.
Because our symptoms is really the body communicating with us. It's such a shame that the conventional medical approach is to just get rid of the symptoms. And you know, essentially what we're talking about here is to have that symptom awareness and act appropriately, knowing what the body is trying to communicate. So just consider learning and listening to the body and learning what they might mean.
An example that I'll often use with that, well, here's two. One is when the low oil light goes on red on our dashboard on our car, we don't take and punch the dashboard for flashing at us, right? We don't get mad and annoyed and say, dang it, that light's catching my attention and I need to focus driving. Thank you out, otherwise I wouldn't have known that my oil was low. And our body symptoms are very much like that. Our body symptoms are simply information for what's happening in the engine. And another way to look at it, and I want to thank a friend, Sam Thorpe, that gave me this analogy, but I really like it. If I go and work out and have a very hard workout, and afterwards I feel tired and sore and I ache, I might come away and tell my friend, oh, what a great workout I had. God, I'm so feeling that workout, and somehow I'm energized and proud of what I'm feeling. Somebody else that has chronic disease might say, oh my God, I'm fatigued and I'm sore, because I don't necessarily have the same understanding that there's a reason for that. And so the same symptoms can be experienced very differently by two different people. So having a bigger picture of understanding can be incredibly enlightening and change our attitude about those symptoms completely. Symptoms are just information, and I know that's easy for me to say and much harder to experience and understand. So I'm not saying that lightly, but I do agree that symptoms are just conscious information to the body, because so much of what's happening in the body we don't necessarily experience or feel. That's happening below the level of awareness. So I agree completely.
I was just wondering whether you're able to offer, maybe a little taster so that viewers can sort of have a more direct experience
Sure.
with what we've been talking about here. That would be amazing, if possible.
Sure. Well, here's what I'll say. And as a trainer, I have to be very cognizant, because I tell all my students this, that what the relationships and ideas and connections that one person has to their illness is completely unique to them. Their experiences, their emotions, their beliefs. So on one hand, it's absolutely impossible for me, and I feel, because there's so many different people that are listening, and each person has their own unique experience and relationship to their condition, that there's no way that I can address each person individually, right? That's impossible. And EFT and matrix reimprinting is always done best individually, whether a person is learning it for themselves or whether they're working with a practitioner. So I have to begin with that caveat. And we can't go back to a distinct. EFT and matrix reimprinting are always best used when applied to direct experiences and events that have happened in one's life. So since we can't possibly do that in this forum, what I can do comfortably is we're going to do a type of matrix reimprinting with what we call a future self. In other words, so I'm going to go ahead and lead, and whoever is listening, so you that are listening, are going to tap along with what I'm doing and repeat what I'm saying. And I'm going to lead you in an exercise that's going to go to a future self that is feeling healthy and whole. And so we're going to use the matrix reimprinting. Instead of going backwards in time, we're going to use it a little bit to go forwards in time and to be able to gain an experience or gain information and bring it back, in a sense, to the future moment. So I'm going to go ahead and I'm going to lift my hand up here because we're going to be tapping on different finger points for you to see, but you don't have to hold it up in the air. You can hold it in a relaxed position in your lap so that it's more comfortable and not straining for you. But I'm going to hold it up here at the beginning so that you can at least see. Okay, so I want you to go ahead first and just get comfortable however you're sitting or lying as you're watching this, and just allow your body to find as best a comfortable position as you can. So we'll begin that way. I'm going to go ahead and invite you to take your dominant hand, whatever is most comfortable as far as that goes, and you're going to go ahead and use either one or two fingers. Okay, so you can use your second finger, or your second and third finger, whatever is more comfortable for you. And I'm going to have you start to very gently and rhythmically tap on some different points on your hand, and I'll show you what they are first. So if you have your hand like this and it's facing your heart, so to speak, towards you, you're going to tap on the top tip of your thumb, top where the nail bed meets right here on the tip of the second finger, and the third finger, and the fourth finger, and the fifth finger, and the outside of the hand, and the flat of the wrist. And then you're just going to keep doing that over and over and over and over. So I'm going to invite you to just throughout this whole time, you're going to be gently tapping on those points. And when you start to get to the point that you can stop thinking about what you're doing, so your hand is just going around rhythmically, gently, slowly, that side of hand, palm, second, third, fourth, fifth, that side of hand. Just keep going in a circle. And when you start to become so comfortable with that, then you don't have to look. I'd invite you to soften your gaze or close your eyes. So we'll go ahead and do that. Excuse me. So once your eyes are relaxed, hands relaxed, you're continuing to tap in a circle. I'm going to ask you, some people do this in a different way. Some people visualize, some people sense. However you sense these, I want you to go ahead, and the invitation is to find a future you. And what I mean by that is perhaps you're going out in time, a month, a year, 5 years, it doesn't really matter where. Somehow imagine, make up, find future you that you sense is feeling really good, really healthy, has made some major turnaround with relationship to your condition. And I invite you to find that self, and however you sense or see them, just notice, however you notice, that they are really doing well. They are really feeling healthy. If you're even open to the possibility of a future self that has beaten this condition, and whatever that means for you. When you find and sense that future self, I'd invite you to introduce yourself, connect with them. It could be silently, it can be aloud. They probably already know who you are, but go ahead and just meet however you would like to meet with them and connect with them. Good. And just take a minute to do that and allow whatever connecting words and sense visually, auditorily need to happen there. Notice how they are seeing you and being with you, and notice how you are with them. And then my invitation to you is to go ahead and ask them this question. Ask your future self what information that they would like to share with you that either you need to know right now with regard to your own healing, or what it is that they would like to share with you about their experience in their healing that they think would be important for you to know, the direction that you needed to take, the understanding that you need to evolve into, the work that you need to do. It could be anything. It's really a matter of listening and being still and quiet enough to hear what they have to say. So I'm just going to go ahead and allow a little bit of silence and allow for whatever unfolds in that conversation to happen for you. Very good. Now I know you can do this on your own after watching this, and you could be more spacious with your time. There's no reason you can't come back here. Give yourself more time. But we'll go ahead and wind this down for this exercise. In whatever information that you received, please thank them. Please thank your future self for providing that insight, that information, that guidance. I want you to just notice how it feels to have gotten that information. And then what I would like you to do is I would like you to see if you can take that experience with that future self. Notice if there is any color that feels good to you, that you notice in and around that experience, or that would be helpful to bring into that experience, whether you infuse it with a shade of color that feels good for you, because colors do have benefits to be able to work with this. And I would like you to take that hand that you're tapping on and put it over your heart, and take your tapping hand and put it over that hand over your heart. And I invite you now to take that information, that learning, that experience, that color, and those insights. And I invite you to take it in through the top of your head, imagining that it's coming into your head, rewiring all the neural pathways in your brain with this new and updated information as far as how it would look and feel to be in a more healed state. Take it in through the top of your head. Allow those good feelings, and insights, and information and color associated with that, and bring it down through all the cells of your body, especially the cells of your body that give you problems, and the areas of your body that has pain. Allow that new information to filter through all the cells of your body with this new information, and then allow that information and those feelings to come up into your heart. Allow that experience to fill your heart. Let it expand and expand. And when you're ready, take a deep breath in and exhale it from your heart, through your body, out to the universe in 360 degrees. This is a beginning re-imprinting exercise that can be of help when we visit a sense of ourselves that is in a place that's better than where we are now. And that future part of ourselves that can inform us, that can give us information outside of our perspective in the way we feel limited, stuck, at the effect of our condition. And that kind of information can often guide directions of where we need to move. That is less self-sabotaging, that is less stressed, that is less hopeless, etc. So I know it's just a singular exercise, but it can be a very powerful one in itself. So I invite you to do that. And when you do that, you can absolutely do it in repeated instances. The more that we start to work with our past and future selves, the more comfortable we become with that exercise, and it actually becomes easier.
This was just such a lovely exercise. Very, very simple. If people decide that this is something that speaks to them and they would like to pursue this and do more work with this, where can they find out more about you, about what you do, and of course EFT Matrix and mental health as well?
Mm-hmm. Sure. Well, if somebody's either interested in working personally or getting training in any of these techniques, the easiest, or to read articles or any of the research, the easiest one, our website is www.efttappingtraining.com. I'm also happy to work with, because I'm a trainer for multiple organizations and have connections around the world, I can always send you different resources in different directions and help you find practitioners that are close to you. So I'm more than happy to do that. I do that a lot. So our website's probably the best way to either, you can get on the email list and get regular articles and videos that we produce about this work. And I'm happy to help in any way that I can.
So I really do want to thank you for sharing all this great information. I'm sure people will find it enlightening, because you touched on some very, very important points, and that may not be obvious to people necessarily, but it's very important to have that awareness, whether it comes to symptoms or our previous bad experiences, traumatic experiences, and addressing those in order to heal. Because without it, it's just not going to be easy, and sometimes it may not even be possible to fully heal without addressing those issues. So thank you again for your time and for sharing so generously your knowledge and expertise. It is very, very, very much appreciated.
Thank you for the opportunity, Dr. Eva. Thank you for bringing the summit to so many people that are going to get so much out of this. I know that. So I really appreciate all the time and effort and energy. I know what it takes to put one of these on, and it's an immense amount of work. So thank you.